you deal with suicide ideation in your CBT work?
Yeah. So first of all, suicide ideation is a very broad term, but if there's any reason to believe that a patient is suicidal, then you have to ask questions. And Tori is very good at this, by the way. But you ask a series of questions, and what I think is very valuable is a scale that I developed many, many decades ago, actually, called the Suicide Intent Scale. And this actually turned out to be a very good predictor of ultimate suicide. And so you ask questions from this scale, and you can then determine just how suicidal the person is and whether it's something you should take very seriously or moderately seriously, or just something that is transient and of not great significance. So first you have to assess the degree of suicidality. Now, if there's a large degree of suicide intent, then you have to prepare a suicide plan. And it would take a whole workshop to be able to discuss with you what the different suicide plans, how to go about this with the patient. But it just so happens that our very next workshop, we're going to have a whole day devoted to how you handle the suicidal patient. But in general, what I found in the patients that I was dealing with is that they are hopeless, and you have to then do something to address the hopelessness. Either there's a big cognitive distortion. For example, somebody thinks that he's dying of cancer and he actually isn't. Or if the person just feels that problems are insoluble and you do some problem solving with him or something of that nature. So one of the key things in the suicidal patient is to use your skills to ferret out what the type of hopelessness is and then to try to reverse it. So that, and actually now we have a whole book, a 600-page book on this, so I can't expect to give you all the knowledge in just a few minutes, and as I